away to Penn for college at the age of 16. I don't know how I managed that, but I did, and then I graduated from there and went to medical school. I was 19. I don't think there was anything pivotal. My parents acted as if I were very, very bright, which delusion carried on till about my first week at Penn, but it was helpful. It gave me great self-confidence, and I was always interested in science, and I was interested in the persona of our family doctor, and I had a chemistry teacher whom I was wild about, who had been kept from medical school by finances, and I think I had a crush on him, and all those things came together, and I decided to be a pre-med. Well, in college, about half of all the freshman students were pre-med, and they got rapidly weeded out with the first and the second chemistry course, and I just happened to love chemistry. In medical school, we started with about 80 in the class, and about 8 were women. And the senior women called us together within the first week and said, "We're going to tell you where the bathroom for women is. It's in the basement, and it's the only one in the whole building." So when we collected specimens for biochemical purposes, the lab being on the 3rd floor, we had to go down to the women today would not stand for such a demeaning performance in the location of the ladies' room. I loved medical school, and for many years here in Wilmington, I precepted third-year medical students from a school that shall remain unnamed, and uniformly they weren't enjoying themselves, and I just think medical school was a wonderful part of life. During my residency here in town, I had planned to be an ophthalmologist. It seemed to be a nice, clean specialty with defined hours. My father thought, that's good, you can get married and have a family and still have some time. But when I had internal medicine here during my internship, I fell in love with that as a discipline, and so I stayed on for a residency in medicine. I think as a generality, and others might disagree with me, that they were more exposed to doctors who were unhappy, that the general attitude between patients and doctors had changed, and that came along somewhat with specialization, which provided good medicine, but to the detriment of some personal interaction. I remember as evidence of this going to an endocrine meeting at the Hospital University of Pennsylvania and having dinner with a man who said, "I do the thyroid enlargement consults, and I can tell you I never see the same patient twice." I thought, what a terrible way to live. That wasn't my concept of medicine, and that's really not the concept of most young medical students, who are very idealistic. Personality-wise, I hardly ever met a medical student that I thought had an inappropriate attitude, just the way the century evolved. The ophthalmologist who made me get interested in the discipline was Dr. Bill Lamont, whose father, I think, had also been an ophthalmologist in Wilmington. And my 2 medical residents now, unfortunately both deceased recently, Dr. Bill Holloway and Dr. Barrett Heckler, made me think medicine was just so interesting and so much fun that they had a profound influence on me. And the chief of medicine, Dr. Lewis B. Flynn, for whom the library in this building is named, was an inspiration too. Well, when I started medical school, there was one antibiotic only, penicillin, and I think there was one sulfa. That's a very limited palette of anti-infectious agents. The others all came in year after year. There were new agents. The type of patients who come to a private PCP, personal care physician's office, are often respiratory infections, this pain, that pain, sore throat, ear pain, none of which used to be addressed in internal medicine residencies. If you'd had meningitis or endocarditis, I would have been sharp, but nobody'd ever said anything about sore throats. And that's been remediated by the new 20 years or so family medicine residencies, where they're much more trained to be generalists and interested in and competent in the common daily elements of daily living for most people. It was so gradual and so unremarkable and so without stress that it's hard to remember how it was achieved, and that also intrigued me, so that I worked a long time on eyewitness reports and wrote a paper which was printed in Delaware history called Desegregating the Delaware Hospital: How, Why, and When. Because nobody had a clear memory of it. In fact, I got different stories, estimates from different people, which meant, to my pleasure, that it was a non-event. It didn't take place, it took place overnight in parts of the hospital, but it didn't take place overnight in the entire hospital. I was a member of the Academy. I particularly loved their annual lecture and formal dinner. So many of the women had beautiful dresses. That's a funny thing to remember. And all of the medical society committees to which I went in and out of were in the Academy building. And early on I became active with the Delaware Medical Journal, which occupied a small office in the basement. So I was in the building all the time, admired the building, which shows so well in the drawing here in the present Academy of Medicine. So the Academy was responsible for medical education for so long, and as a meeting place for medical education for so long, that it was hard to differentiate what was Academy activity or just Academy location. The unique role, as far as I know, in the community, done with any intensity, is the availability of patient education materials, and also of the kinds of conferences which are to educate consumers. It seems to me that the medical center has begun to pick up that kind of conference. Pick it up may be the wrong word. Sponsor that kind of conference. But those kinds of things are great for the Academy to do. The library, the hospitals each, when there was an each, now there's just two, have had so much improved medical libraries that the Academy Library hasn't been as necessary. On the other hand, the availability of electronic requesting of articles and transmission of articles is made so much easier that the Academy as a core library should have a definite role. For someone like you and me, the fact that the Academy has had bound volumes from the 30s and 40s when no one else has, because they haven't been electronically cataloged, shelved. The fact that there's a library that one can consult that sort of thing is important. I've been a busybody, but probably the job I did the longest and enjoyed the most was being editor of the Delaware Medical Journal for about 15 years, and I worked with it before then when Dr. Robert Flynn, who is Dr. Lewis Flynn's son, they were both chiefs of medicine here. He was editor and he let me do a lot, and then I became editor. I liked that. I've liked the history of medicine articles that I've published, 2 or 3 in major journals. But I'd like to be remembered mostly as a kind physician and a competent physician for the patients that I took care of in my own office for 15 years.